Hello everyone. I am Dr. Pradeep Rachakonda. I am a senior consultant cardiac and mix surgeon. Today I'll talk a little bit about the lipid profile. We all would have come across cholesterol tests at some point or other, either for ourselves or for our relatives. So, what do those numbers actually mean? See, when it comes to a lipid profile, there are five values that we need to keep in mind, mainly total cholesterol, triglycerides, low density lipoproteins, and high density lipoproteins, and one more test which I'll talk a little later. So, what should these levels be, and how do you know if you have a normal lipid profile or not? So, typically, we expect or we try to keep the total cholesterol to less than 200 milligrams per deciliter, the triglycerides to less than 150 milligrams per deciliter, and LDL cholesterol. The LDL cholesterol is responsible for causing the plaques and other blocks in the heart and other blood vessels of the body. So, for a normal healthy person without any other disease, we would like to have the LDL cholesterol less than 120. Suppose you have any contributing diseases like diabetes or hypertension or other problems that may put you at risk for blockages, etc., like kidney disease, we would target the LDL cholesterol to less than 100. And people who are very high risk for cardiac events, like who have already had a heart attack or stroke, or who have undergone stenting or bypass surgery, who are more than 75 years of age, who have other peripheral arterial disease, etc., we would target the LDL cholesterol to less than 70 milligram per deciliter. So we've talked about cholesterol, we've talked about triglycerides, we've talked about the LDL cholesterol. There is one more cholesterol called HDL, which is called high density lipoproteins. It is actually the good cholesterol. It works in the opposite way of LDL cholesterol. See, normally LDL cholesterol carries cholesterol from the liver and it circulates in the blood and deposits the cholesterol in the blood vessels inside. HDL cholesterol mobilizes that cholesterol from the inside blood vessel and carries it back for metabolism to the liver. So, see, HDL cholesterol always, the higher the HDL cholesterol, the better it is. So, for a male, we target it to be more than 45, while for a female, we would like to have the HDL cholesterol more than 55 milligrams per deciliter. Overall, when someone has a higher HDL cholesterol, for example, more than 50 or 60, it always, we believe it is kind of protective for the heart. So, when we look at a lipid profile, there will be several other ratios that some labs might give you, but the most important things to remember are total cholesterol less than 200, triglycerides less than 150, LDL cholesterol ideally less than 120, and HDL cholesterol more than 45 to 50. So if you see any abnormalities in any of these values, then we will have to take appropriate action, either in the form of diet and lifestyle modification, exercise, or if needed, start a medication like cholesterol lowering drugs, etc. There are two other tests in addition to these which you may want to keep in mind. One is called ApoB test. It tests the apolipoprotein B in the blood. Apolipoprotein B100 is a carrier particle for the low density lipoproteins. Unlike LDL cholesterol, this is more directly gives an estimate of the cholesterol load in the blood. Sometimes the LDL might be normal, but if the apolipoB is increased for multiple reasons, the person still has a higher risk for getting heart blocks even though the other values are normal. So there are some genetic conditions which may increase the patient's ApoB100 values. The second one is called lipoprotein A. Lipoprotein A is a subset of low density lipoproteins, and this cholesterol is more sticky than the regular LDLs. So even a person who has a normal LDL, but if he has a higher proportion of lipoprotein A, we call it sticky cholesterol because it sticks to the blood vessels. And so they have higher risk for developing blockages in the heart, the brain, and peripheral vascular disease, in the rest of the blood vessels, etc. So, my friends, please remember to do lipid check once a year at least if you're over 40-45 years. Get your cholesterol under control, and if it is not under control, take the appropriate measures like diet and lifestyle modification, etc. And if needed, add a medicine also and get the cholesterol under control. Thank you.